Why should women have home births?
Yes.
Victoria?
I'm sorry? Why should women have home birth? They should have a home birth if that's what they want.
Mm-hmm.
They should have a hospital birth if that's what they want. So if they truly want a low intervention, normal physiologic birth, they should have.
What does physiological mean?
Physiologic means something that would automatically happen whether you intervened or not. So just allowing the body to do what it's designed to do, what it will do if you don't intervene, if you don't try to change it or alter the process. It's just the process of birth itself.
How do home births facilitate and help physiological birth?
Well, because in the home setting, you're not intervening, you're not doing a whole lot of you're not doing any continuous monitoring. So the patient is mobile, the patient's allowed to eat and drink as they please, they're allowed to move around as they please. Most of the time in a home birth, you have access to water, pools, things that are helpful for pain management versus in a hospital setting. You don't always have all of those options. You're not always allowed to move around. You're not always allowed to eat and drink. You don't always have water available to you to use for hydrotherapy for pain. So you end up getting other interventions that alter the course of the birth, and that it's no longer normal, low risk, and physiologic. It's sort of an altered process that we're managing to prevent complications versus just sort of allowing the process to unfold and allowing the mom to do what her body is telling her that she wants to do.
So why do you think hospitals don't support physiological birth the way that home births do?
Well, I think that, there's a couple of reasons. One, the providers that practice in the hospital setting aren't always exposed to normal and physiologic. It's in the education system. We're not always discussing what normal physiologic birth, unintervened birth looks like. And so it's just not something that's educated in the that people are provided, right? They're taught to manage a labor and manage a birth versus allow a woman to labor and birth. It's just sort of, they don't know what that looks like. And it's almost like this sort of a lost art. You know, it's just something that's just not taught and that people aren't exposed to. But then also hospitals experience a lot of liability issues, you know, and so there's always, I'm trying to cover my butt. I'm always trying to make sure that I did all the things that I was supposed to do, and I made sure that this, so it's from a very fear-based, trying to protect themselves sort of environment and setting, which isn't always friendly to normal physiologic birth. You know, you can't always do what you want to do because the hospital is trying to protect themselves from any possible liability, and it's not really focused on what the woman wants and what the woman needs as much as it's focused on protecting the providers and protecting the corporation, exactly, or the organization, right? And specifically the providers that are performing those services. Unfortunately, that does happen. You know, I've seen it where there were poor outcomes that weren't actually even related to the provider's care. Right. And it was just, you know, something unforeseen and something that nobody could prevent. And, you know, the OBGYN and the midwife managed it as best that they could, but they still got sued. The hospital got sued, the providers got sued, everybody got sued. And you know, the woman won the suit because that's sort of the nature of obstetrics these days. And so a lot of providers practice scared. They practice afraid that they're going to get sued and that they're going to lose their license and that they're going to, you know, have some sort of adverse outcome. And so it's almost like moms versus doctors and providers in the hospitals, and it's mom versus the hospital. And you know, when you do that and you go into a setting like that where you are trying to protect yourself and the hospital is trying to protect themselves, it's just like any other relationship. It's really not going to work. You're going to bump heads, and it does not support the way the hospital system is set. It does not support a normal physiologic birth because they're so afraid of what's going to happen if they do. So, you know, I think trying to re-educate people on what normal physiologic birth looks like, trying to allow for that when you can. I think just sort of exposing people to it, normalizing it, humanizing birth. Like, this is a normal human thing. We were designed to do this, but you know, and yes, sometimes things go wrong and things don't always go as planned. But for the vast majority of births and women and pregnancies, it will work fine if you don't intervene in the process.
For people who are new to home birth and physiological home birth, what are some tips that you can give them as a midwife to help them maybe start to educate themselves on that?
I think we're really blessed with technology these days because everybody has like home birth videos now, and there's a ton of information and videos out there now for like what it looks like. And so I always tell my patients when I first get them, if they're like, I'm not really sure what that looks like what does that look like, what can I expect? I tell them go watch videos, right? Go on YouTube, go watch videos. There are several midwives that film their deliveries and post them on Instagram, and so I give them those links and I say, go watch this, go watch this, go watch C-section deliveries, go watch hospital deliveries with monitoring and epidurals, go watch gentle C-sections, go watch emergency C-sections. There's just so much. Watch all of it so you can get an idea of what it looks like and see what's
watching videos every day,
right? And see what speaks to you. You know, like what are you seeing that you like? What are you drawn to? What do you feel like I don't really understand? And so I have a lot of those conversations with people as you know, they watch me. Okay, what did you learn this week? What did you see this week? How did you feel about that? Does that sound like something you want? Does that sound like what did you think of that? And so we get to talk about like why do we do continuous monitoring and why do we get epidurals? And so we get to have those conversations because it's really hard to dump all that information on somebody and say, here's all the things, and then expect them to retain something and have some sort of meaningful learning experience from it. So I just tell them, watch videos, we'll talk about what you see in the videos, and then I give them information, right? And of course we talk about it, like I could provide that information. We do childbirth education classes, right, where we just go through the motions, what to expect. And so telling people what to expect, explaining what the process looks like, talking about what that process looks like in different settings, why we do this, why we do that, and really just educating, making sure that they can make an informed decision. And I wouldn't be surprised and I have had this where some people are like, nope, I changed my mind. This is not something, which is fine. I think midwifery, yes, we support normal physiologic birth. We believe that every birth can be normal and low risk and physiologic if we support that process. But really, in terms of a midwife, my philosophy is the woman has the right to choose whatever she wants to choose, and limiting her options is taking away her autonomy. And you know, how do we expect people to be empowered parents, and how do we expect people to consciously parent? How do we expect people to transition into motherhood, because you have to do that transition every baby? How do we expect people to raise communities if we're traumatizing them every time they have a child? You know,
last question. What is the difference between
she's so psyched up. I'm so proud of you.
Yes. What is the difference between a doula and a midwife?
This is a good question. So, midwives and doulas, I believe, have the same education in terms of what normal physiologic birth is, right? We both function to guide a woman through that pregnancy, to educate her through the pregnancy, to support her through the pregnancy. But I think midwifery, you're trained to recognize complications. You're trained to know when to intervene. You're trained to know what interventions are appropriate in a certain scenario and what aren't. So you get a little bit more hands-on on that looks normal, that doesn't look normal, in terms of the actual birth and labor itself and the pregnancy itself, right? So when do I need to get her to a higher level of care? And I know that there are lots of doulas that understand that, but I think the training is different. And you know, as a midwife, I'm trained to intervene and to understand when I intervene and what those interventions are and what's appropriate and how well to do them. So I think it's really more of a safety thing in terms of training. It's just, I'm trained to do different things. I'm trained to intervene, whereas I think you're trained to get somebody to intervene. That's sort of the difference between a doula. But I think we do essentially a lot. Obviously, as a midwife, I have a license and I can order labs and I can order ultrasounds. So I'm really doing a lot of management of the pregnancy and just sort of monitoring it and watching from a clinical standpoint. And I think doulas watch, but not so much from a clinical standpoint. They just know when to get a clinical person involved, which is absolutely essential. You know, I think every family should have a doula. Just a family doula. This is the family doula.
Not the family doula.
Yes.
That's gonna be my new website.
The family doula. Yeah, if every family had a doula, then we would catch so many things earlier. You know.
Awesome.